Today we're going to start another important topic, which is inflammatory enlargement of the gingiva. We will study the histopathology. So let's start. Bismillahirrahmanirrahim. So basically, what happens that inflammatory enlargement of the gingiva typically have inflammatory process. We say so if it has chronic inflammation, chronic inflammatory gingival growth. So the histopath will show exudative and proliferative features of chronic inflammation. Okay, if and the lesion if the deep red or bluish, so it will have a smooth shiny surface and they will bleed easily. You will see in the histopath. Okay, then they will have a very preponderance of inflammatory cells and fluid with the vascular engorgement, and you will see a capillary formation and associative degenerative changes. Okay, you will also have the lesions will have the greater fibrotic component and abundance of fibroblast and collagen fibers, because we know that fibrosis is responsible for gingival enlargement. Now in the plasma cell gingivitis, the oral epithelium will show spongiosis, edema of the cells, infiltration with the inflammatory cells. Okay, and basically, and you will see the signs of damage in the lower spinous layer and basal layers. The connective tissue will have a dense infiltrate of the plasma cells, basically. Okay, that will extend it to the oral epithelium. Okay, now the plasma cell gingivitis, which is actually allergic in the origin and possibly a reaction to the components of like due to chewing gum, dentifrice, or various dietary components items. Cessation of this of exposure to the allergen, it bring resolution. Basically, it will resolve the lesion. Okay, now when basically when you have a very large number of plasma cells that appear, so it is also associated with the aggressive periodontitis. Okay, now, a solitary plasma cell tumor, which is plasmacytoma, if you can be described, which is present in the nasopharynx and rarely in the oral mucosa. So, it is a slow growing pedunculated tumor, means it is a slowly growing tumor with a pink and smooth surface. It is composed of normal plasma cells. It is benign, and the oral manifestations of multiple myeloma, which is a malignant B cell tumor of the bone marrow. Okay, B cell tumor. The treatment for this is reversible. First of all, you have to remove the pathologic factor, like if it is plaque or biofilm, and correction of environmental factors. Okay, basically in several forms of inflammatory enlargement, surgical approach can also be done also to the patient.